You ever wondered what really happens behind the doors of nursing homes? We often hear about the care and support they provide, but what many people don't realize is that there's another side to the story, one that rarely gets talked about. While some facilities offer quality care, others are plagued by hidden issues that can affect the health, safety, and well-being of the residents. And the worst part? Families don't always find out about these problems until it's too late. In this video, we're uncovering the 6 dark sides of nursing homes that everyone should know. From chronic understaffing and hidden fees to mistreatment and medical neglect, these are the problems that can turn what should be a place of care into a source of suffering. By the end of this video, you'll have the knowledge to spot red flags, ask the right questions, and ensure that you or your loved ones don't become victims of these hidden dangers. Stay with me until the end, because one of the most overlooked issues is something that affects nearly every resident, but almost no one talks about it until it's too late. You don't want to miss it. Let's get started. Number 1, understaffing leads to neglect. One of the biggest and most alarming problems in nursing homes is chronic understaffing. Many facilities simply don't have enough caregivers to properly attend to all the residents. And when staff members are stretched too thin, it's the residents who suffer the most. What does this look like in reality? Missed meals, delayed medications, unanswered call buttons, and seniors left sitting in soiled clothes for hours? It's not because caregivers don't care, it's because there aren't enough hands to do the work. And as a result, the very people who need help the most often don't get it when they need it. When nursing home staff are overworked, even basic needs go unmet. Residents may not be repositioned in their beds frequently enough, leading to painful bed sores. Those who need assistance with eating may not get the help they require, resulting in malnutrition or dehydration. And in some cases, critical medications aren't given on time or at all, leading to serious health complications. This lack of attention can cause a rapid decline in health, and for many, it happens so gradually that families don't realize what's going on until it's too late. Take the case of Walter, an 82-year-old man, whose family placed him in what they believed was a highly rated facility. At first, everything seemed fine, but over time, his daughter noticed something was off. Every time she visited, he seemed more frail, confused, and disoriented. It wasn't until she started asking questions that she discovered the truth. His medications had been skipped multiple times because the staff was too overwhelmed. He had lost weight because no one was making sure he ate. And worst of all, he had developed painful sores from sitting in the same position for too long. His family trusted the facility to care for him, but due to understaffing, he was left to deteriorate. This problem isn't just frustrating, it's dangerous. Studies have shown that nursing homes with low staff-to-resident ratios have higher rates of falls, infections, and hospitalizations. Without enough caregivers, residents don't get regular check-ins, which means that medical emergencies can go unnoticed for far too long. And for seniors, every minute counts. So what can you do if you or a loved one is considering a nursing home? Staffing levels should be one of the first things you investigate. Ask how many caregivers are available per resident, both during the day and overnight. Visit at different times and observe how quickly call buttons are answered. If staff seem rushed, overworked, or unable to provide immediate assistance, that's a major red flag. Because when a facility is understaffed, neglect isn't just possible, it's inevitable. And the truth is, neglect isn't the only concern. Number 2, poor hygiene and unsanitary conditions. When you think of a nursing home, you expect a clean and well-maintained environment. After all, these facilities are responsible for the health and safety of vulnerable residents. But the reality is that many nursing homes struggle to maintain proper hygiene, and the consequences can be devastating. Dirty floors, unwashed linens, foul odors, and even infestations of pests. These are just some of the problems that families discover too late. And for seniors with weakened immune systems, poor sanitation isn't just unpleasant, it's dangerous. Infections spread rapidly in unclean environments. Residents who are left in soiled clothing or unchanged diapers are at high risk for urinary tract infections and painful skin conditions. Shared equipment, such as wheelchairs or medical devices, can harbor bacteria when not properly sanitized. And something as simple as a caregiver forgetting to wash their hands can lead to outbreaks of illnesses like pneumonia or gastrointestinal infections. In extreme cases, unsanitary conditions have led to widespread disease outbreaks, hospitalizations, and even preventable deaths. Take the case of Eleanor, a 79-year-old woman who entered a nursing home for short-term rehabilitation after a fall. Her family visited regularly and noticed a persistent odor in the hallways, but staff assured them it was nothing to worry about. Within a few weeks, Eleanor developed a severe respiratory infection. The cause? Dirty ventilation systems that had gone unchecked for years. By the time the issue was discovered, multiple residents had fallen ill, and Eleanor had to be hospitalized. What her family thought was a safe environment had, in fact, exposed her to unnecessary health risks. The signs of poor hygiene aren't always obvious at first. A facility may look presentable during a scheduled tour, but what happens behind the scenes can be a different story. If you or a loved one is considering a nursing home, pay attention to small details. Are the floors and bathrooms clean? Do the hallways smell fresh? Or is there a lingering odor of urine? Are residents well-groomed with clean clothes and brushed hair? A well-maintained facility will have strict cleaning protocols and enough staff to enforce them. Cleanliness isn't just about comfort, it's about health and dignity. Residents deserve to live in an environment that promotes their well-being, not one that puts them at risk. But as troubling as unsanitary conditions can be, the next issue on our list is even more disturbing. It's something that happens far too often behind closed doors, and yet many families never find out until it's too late. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Number 3, emotional and physical abuse. One of the most heartbreaking realities of nursing homes is that some residents experience emotional and even physical mistreatment at the hands of the very people entrusted with their care. It's something no family wants to imagine, yet reports of verbal insults, neglect, and outright abuse continue to surface year after year. And because many seniors have cognitive impairments or difficulty speaking up, these incidents often go unreported for far too long. Emotional abuse can be subtle but deeply damaging. It includes staff members ignoring residents, speaking to them harshly, or making them feel like a burden. Imagine being completely dependent on someone for your daily needs, only to be treated with impatience, frustration, or even cruelty. Over time, this kind of treatment leads to depression, anxiety, and a deep sense of isolation. Some residents stop eating, others withdraw, losing interest in activities they once enjoyed. And in extreme cases, they simply give up on life. But emotional mistreatment isn't the only concern. Physical abuse is more common than most people realize. Some caregivers, overwhelmed by stress or frustration, lash out at residents. Others take advantage of seniors who are unable to defend themselves, using unnecessary force when handling them, or even leaving them in bed for hours as punishment. And then there's the issue of resident-on-resident aggression. With limited supervision, disputes can escalate into physical altercations, and vulnerable seniors may end up hurt without anyone stepping in to protect them. Take the case of Harold, an 81-year-old man who moved into a nursing home after his mobility declined. His family noticed bruises on his arms, but when they asked about them, staff brushed it off as a minor fall. Over time, Harold became withdrawn and fearful. It wasn't until a visiting relative overheard a staff member speaking to him in a degrading tone that the truth came to light. He had been roughly handled by caregivers who saw him as a nuisance, rather than a person deserving of dignity and respect. His family had trusted the facility to care for him, but instead he had been living in fear. So how can you protect yourself or a loved one? The key is vigilance. If a resident suddenly becomes withdrawn, fearful, or refuses to talk about their experiences, that could be a warning sign. Frequent, unexplainable bruises, bed sores, or sudden weight loss should never be ignored. And most importantly, visit at unexpected times. Abuse often happens when staff believe no one is watching. By showing up regularly and asking direct questions, you send a clear message that your loved one is not alone. No one deserves to feel afraid in a place that is supposed to provide care. And yet, abuse remains one of the darkest realities of the nursing home system. But as troubling as this is, the next issue we're about to discuss is something that can cause just as much harm. Only this time, the damage isn't just physical or emotional. It's financial, and it's a problem more families are discovering the hard way. Number 4, hidden fees and financial exploitation. Many families believe that once they choose a nursing home and agree on a payment plan, they know exactly what to expect. But what they don't realize is that hidden fees, misleading contracts, and even outright financial exploitation are more common than they think. For some, the cost of care starts off manageable, only to skyrocket over time with unexplained charges. Others discover too late that their loved one's personal funds are being drained through deceptive practices, leaving them with nothing when they need it most. One of the most common financial traps comes in the form of vague or misleading contracts. Families often sign agreements that seem clear at first, only to be hit with extra charges for additional care that should have been included. Simple services like helping a resident get dressed, escorting them to meals, or assisting them with mobility can be listed as separate fees, adding hundreds or even thousands of dollars to the bill each month. In some cases, families only realize what's happening after they've been billed for months of services they never even agreed to. But that's not the only concern. Some nursing homes have been caught taking advantage of residents directly, especially those with cognitive impairments who may not fully understand their financial situation. Unethical facilities have been known to manipulate seniors into signing over control of their bank accounts, pensions, or even property. In the worst cases, staff members have been caught forging signatures, altering financial documents, or pressuring residents into making financial decisions that leave them vulnerable and broke. Consider the case of Barbara, an 84-year-old woman who had been living in a nursing home for 2 years. Her family had carefully budgeted for her care, making sure she had enough funds to cover her expenses. But one day her daughter noticed that Barbara's savings account had been almost completely drained. Confused, she requested financial records and discovered that Barbara had been billed for services she never received. Physical therapy sessions she never attended, medication refills she didn't need, and a long list of unexplained administrative fees. When she confronted the nursing home, they claimed it was all legitimate. But after further investigation, it was clear that Barbara had been systematically overcharged for months. So how can you protect yourself or a loved one from financial exploitation? First, always request a detailed breakdown of charges and review them carefully. If a bill seems unusually high, don't be afraid to ask questions. Second, avoid signing any documents without fully understanding them. If a contract contains vague terms like additional services may apply, ask for clarification in writing. And third, if a resident has cognitive impairments, make sure a trusted family member or legal guardian is monitoring their finances closely to prevent unauthorized withdrawals or unexpected changes. Financial exploitation is one of the most devastating realities of nursing homes because it doesn't just take money, it takes away security, independence, and peace of mind. And as troubling as this is, the next issue we're about to discuss is just as serious. It's something that could mean the difference between life and death, and yet far too many nursing homes fail to handle it properly. If you're still watching this video and finding these insights valuable, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Number 5, limited medical oversight. Many nursing homes advertise themselves as places where residents receive proper medical supervision, but the reality is often far different from what families expect. In too many cases, seniors experience long delays in receiving medical attention, are prescribed unnecessary medications to keep them sedated, or have their health concerns ignored until it's too late. When a facility lacks proper medical oversight, even minor health issues can escalate into life-threatening emergencies. One of the biggest problems is the lack of on-site medical professionals. While some high-quality nursing homes have doctors or skilled nurses readily available, others only have part-time medical staff who visit occasionally, leaving residents without proper care when they need it most. If a resident suddenly falls ill or experiences severe pain, they might have to wait hours or even days before receiving medical attention. And for seniors with chronic conditions like diabetes, heart disease, or dementia, this delay can be dangerous. Another major issue is the overuse of medication, particularly sedatives and antipsychotic drugs. Some nursing homes resort to medicating residents as a way to manage behavior rather than addressing their actual needs. Instead of providing personalized care, staff may give residents powerful drugs to keep them quiet and docile, even when it's not medically necessary. This practice, sometimes referred to as chemical restraint, can lead to serious side effects, including confusion, falls, and a significantly reduced quality of life. Take the case of Gerald, a 77-year-old man who had always been mentally sharp before moving into a nursing home. Within months, his family noticed a drastic change. He seemed groggy, confused, and disoriented, struggling to hold conversations he once enjoyed. Concerned, his daughter checked his medical records and was shocked to find that he had been prescribed powerful sedatives, medications he had never needed before. When she confronted the staff, she learned that the drugs were given to help manage his restlessness rather than treat any legitimate medical condition. He had been over-medicated, not for his benefit, but for the convenience of the facility. If you or a loved one is in a nursing home, it's important to ask key questions about medical oversight. Is there a doctor on staff, and how often do they visit? How are medications prescribed, and who decides when changes are needed? If a resident becomes sick, how quickly can they receive medical attention? These questions can reveal a lot about the level of care a facility truly provides. Medical oversight isn't just about managing existing conditions. It's about making sure residents receive the care they deserve before small problems become life-threatening emergencies. And while this issue is incredibly serious, the final concern on our list is one that many people overlook. It's something that affects nearly every resident, yet few talk about it until the damage has already been done. Number 6, residents suffer from loneliness and depression. One of the most overlooked issues in nursing homes isn't medical neglect or financial exploitation. It's the emotional toll of loneliness and isolation. Many seniors enter a nursing home expecting a sense of community, but instead, they find themselves spending long hours alone with little to no meaningful interaction. Over time, this loneliness turns into depression, affecting both their mental and physical health. The hardest part? Many families don't even realize it's happening until their loved one has already withdrawn. For seniors, social connections are just as important as medical care. Studies have shown that loneliness in older adults increases the risk of dementia, weakens the immune system, and even shortens lifespan. Yet in many nursing homes, residents spend most of their time sitting in their rooms, staring at the walls, or watching television alone. Staff are often too busy to engage in meaningful conversations, and structured activities, if they exist at all, are poorly attended or uninteresting. The result? A deep sense of disconnection from the world, leading many seniors to lose interest in life itself. Consider the case of Helen, an 80-year-old woman who moved into a nursing home after her husband passed away. At first, she tried to stay positive, hoping to make friends and keep herself busy. But as time passed, she found that staff were always rushing from one task to another, and the other residents barely spoke to each other. The social events were repetitive, uninspired, and lacked real engagement. Soon, Helen stopped trying. She ate alone, spent most of her day in silence, and when her family visited, they noticed the light in her eyes had dimmed. She wasn't sick, but she was suffering. The worst part is that many nursing homes fail to recognize the emotional needs of their residents. They focus on providing food, medications, and basic care, but neglect the human need for companionship. And for seniors who no longer have family visiting regularly, the isolation can be devastating. So how can this be prevented? If you or a loved one is in a nursing home, make social engagement a priority. Ask about structured activities, group outings, and opportunities for residents to form genuine friendships. If your loved one is already in a facility, encourage regular phone calls, video chats, and visits from friends and family. Even something as simple as hiring a companion for a few hours a week can make a world of difference. Loneliness is a silent struggle, but it doesn't have to be inevitable. Nursing homes should be places of care and connection, not isolation and despair. And now that we've covered these 6 dark sides, let's take a moment to reflect on what we've learned and what steps can be taken to make better choices for ourselves and our loved ones. If you're still watching this video and finding these insights valuable, please comment number 6 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Final thoughts. Sorting on Uri Hudson, we've uncovered 6 harsh realities of nursing homes, issues that too many families only realize after it's too late. From understaffing and unsanitary conditions to financial exploitation and emotional neglect, these are problems that can deeply impact the lives of seniors who deserve far better. The truth is, while some nursing homes provide excellent care, many have serious flaws that can put residents at risk. And as loved ones, it's up to us to ask the right questions, pay close attention, and advocate for those who may not be able to speak up for themselves. If you or a family member is considering a nursing home, don't just trust the brochures or the facility's promises. Visit in person, talk to staff, observe how residents are treated, and read reviews from other families. Ask about medical oversight, staff-to-resident ratios, and daily engagement opportunities. And most importantly, never assume that just because a facility looks clean and professional on the outside, it's delivering the care that seniors truly need. Nursing homes should be a place of dignity, care, and respect, not a place where people are forgotten. If today's video has made you think twice about what really happens behind closed doors, then it's already done its job. Awareness is the first step to making better choices for yourself and your loved ones. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.